Hello, and welcome to our panel discussion, Prioritizing Student Mental Health, presented by GoGuardian. My name is Tracy Clements, and I will be moderating the panel today. I have been working in the world of mental health for about 30 years, and I've worked both in schools and in private practice. And here with me today, I have three esteemed panelists that have differing views on mental health. We've tried to bring together a group of panelists who can provide various perspectives because it's always best to have different viewpoints when you're trying to build support systems. So I will let you guys introduce yourselves. Let's start with Rebecca Sears.
Hi, this is my 19th year in public education. I started out in teaching kindergarten in a large school district in Missouri and moved into administration in a very small rural school district as a K-8 principal, and then moved to a larger district as a principal and then eventually assistant superintendent. And I'm currently serving as assistant superintendent in Gravette, Arkansas.
Okay, thank you, Rebecca. Next, let's have Dr. Holly Wilcox.
Hi, everyone. I am a professor at the Johns Hopkins Bloomberg School of Public Health, and I have spent my career focused on youth suicide prevention from a public health standpoint. I serve on the Scientific Council of the American Foundation for Suicide Prevention. I serve as a school board member in the state of Maryland. And I also co-chair our suicide commission, our governor's suicide commission in the state of Maryland. So I'm really excited to be here. Thank you for inviting me.
Thank you, Dr. Wilcox. And next, let's go to Kelly Williams.
Well, I'm Kelly Williams, and I'm a licensed professional counselor here in Missouri. My background is I taught in psychiatric hospitals with youth and youth residential treatments. And I have been doing outpatient for the last 15 years. And we are now branching out and going into schools and providing mental health services into the different school districts in this area in Missouri. So a lot of rural healthcare in the schools. And I'm happy to be here with you guys today too.
So, thank you guys for joining us. Let's start by talking about students today and how mental health comes into play in schools. So Kelly, you said that you guys have branched out into schools. So what are you seeing about mental health in schools today?
Well, what we were seeing is that there's such a need, and there's been such a shift with both parents working. A lot of times it's hard for parents to pick kids up, get them to the office. And we've discovered that if we can get into the schools and we can pull the kids during classes that are non-core classes, that we can see them way more regularly and meet the needs that we weren't otherwise meeting because parents couldn't get them here. And we're just noticing that the more regular we're able to see the kids, the more positive effects we're able to have.
Yeah, so removing some of those barriers to getting into a private practice.
Yes.
How about you, Dr. Wilcox? What kinds of things are you seeing?
I think we always think of mental health as separate from the mission of most school systems, but I really think that it has to become part of the mission because students can't learn and they can't reach their full potential if they're struggling with mental health issues. And so finding a way for schools to be able to provide some type of services and supports, especially thinking about trying to get upstream before someone's in crisis and identify youth early and provide them with the supports and care that they need to be successful, both academically, socially, and in other domains.
Yeah, and I would like to underscore that upstream approach. I think that was one of the things that I found the most difficulty with when I was in a school is school counselors are typically serving way more students than they're supposed to. So we felt like we just ran around and put out fires. And being able to identify concerns upstream is key to getting those interventions in sooner. Sorry for interjecting there. Rebecca, would you like to weigh in from an upper admin perspective?
Yeah, I would echo a lot of what Dr. Wilcox said. When students come to school and they are mentally healthy and physically healthy, they are more ready for learning. And we see that students are more actively engaged in problem solving and have stronger and better relationships with their peers and with caring and supportive adults in the school environment. So mental health is a critical piece in what we do academically also.
Yeah, I think that gets lost a lot of times. And I really like to underscore that as well, that in order for kids to be academically well, they need to be mentally and physically well. So thank you guys. Our next question, what are some examples of successful ways you have seen schools support and or prioritize student mental health? And we'll just go and mix up the order every time. Dr. Wilcox, let's have you weigh in first.
Yeah, I'm a big fan of kind of coming at this issue from multiple angles, if possible. I mean, one example would be to have well-trained mental health providers in the schools who could be doing some of the best practices and supporting students and having enough people and enough coverage for all students. But I also love the idea of thinking about embedding some type of programs into health education class. I think that, in health ed, there's the opportunity to be able to provide some content on mental health. And, there's evidence-based programs that even could be embedded into health education class. And so all students will receive that content, not just, a subset of students. So universal implementation of mental health education as early as we can get. And I'm thinking, I'm working right now in some middle schools. The students are very thirsty for this information about mental health and how to recognize people and what to do if they're struggling with issues such as cutting or depression, anxiety. And so I think that's another example, but there are a whole host of ways and safety nets that can be set up in schools. And I think a multi-tiered approach is always best. Working within a specific school setting to know, use their own data to figure out what the unique needs of the school and the school system are, and then setting up the structure around it to address the needs.
And Kelly, as one of those highly qualified people placed in a school, can you talk a little bit about how you have, just how it works for you being in the school?
So we're actually in 3 different school districts. And the first thing I discovered is every school district has its own personality. So when you get in there, you have to kind of figure out the personality of the school. But we've discovered if we can have a safe place that the kids can come in. The big concern I notice is, the kids want their privacy. And trying to get that accomplished. I'm noticing that the schools are providing so much more education, and the stigma of seeing the counselor is going away. So we are noticing that in all the school districts that kids are seeking out. Unfortunately, there's way more need than we have therapists. So that's the other kind of component. So I've gone in and tried to help teach, like some of the people the school counselors and the people that run the social services, how to do educational groups where they can kind of have lunch groups and kids can come in on certain topics. And in this area, we have it done in 2 or 3 different languages. Because, we have such a cultural difference. But I think the education and taking away the stigma in the schools is really helping to get the kids in there to say that, hey, I'm needing some help. And that's what we're noticing.
Yeah, and I would like to point out that the logistics of having therapists come into the schools is kind of a novel solution. School counselors are not able to meet all of those needs, so partnering with private practitioners to come in and utilize space within the school is a means to get more services in place without the district having to hire additional staff. And from a private practitioner standpoint, your no-show rate goes down,
Yes.
and it just works well for everyone, reduces those barriers and provides additional services.
Yeah.
So, Rebecca, how would you answer this question?
Well, I think having the licensed school counselors there, but then also having the private practice counselors available is huge. We've seen a huge success in that, and being able to get students help and support in dealing with things that they normally maybe wouldn't be able to for various reasons and various barriers. One of the things that we've really seen is really focusing on school culture and strengthening our school culture, creating a positive school culture, a supportive school culture, and a very inclusive school culture. Also having open and honest conversations around mental health. I think Dr. Wilcox also touched on that, but not being afraid to have those conversations and being proactive in those conversations and sharing information with students about if you're feeling this way, what do you do? How do you get the help? And just having those conversations around mental health.
Yeah, it's all interconnected, isn't
Mm-hmm.
it? Like you can't really take one piece of it out. So related to that, have you guys had any experience in using technology to support mental health? Let's start with Rebecca.
So we have had experience using GoGuardian right now in the district I'm in. We currently use GoGuardian just to, if we have students that are searching things on the internet that may be inappropriate, but also our students that may be searching different types of suicide or ways to commit suicide or issues like that that they might be struggling with or cutting. We've been able to see some things like that and find maybe students that aren't having like the outward displays of behaviors that we would typically see that would cause concern, but maybe some of our students that have withdrawn. We've been able to recognize some of, their struggles through by GoGuardian, like flagging different things in emails or internet searches. We've also, in previous districts I've been in, used Beacon and used a tip line, and that was really successful in helping us support students 24 hours a day, and students being able to reach out to somebody and get the help and support they need, even when outside of school hours. And so that is really helpful. And I know personally that there were several interventions that took place that when students were in the middle of attempting suicide, and because of that Beacon program, interventions were able to happen and we were able to get the student the help they needed and save their life.
That's pretty powerful technology.
Yes.
How about you, Kelly? Like, how has technology impacted mental health? Oh, Kelly went away. Well, okay, there you go.
Sorry. Mine comes from a little bit different. So when I go into sessions, a lot of because of parents, I can loop them in. I can do family therapies now. Like I can go into the school and I can include parents in my family therapies, especially like if I do it over their lunch hour and then it accommodates the parent. I've also been able to sit in on like telemed. Some of the rural areas have telemed, and a lot of times give that information. And so I can sit in and provide the information that I don't know why I keep going out there. I'm sorry. I can provide the information to the doctor or to the nurse practitioner, which helps us with what we're doing.
Yeah,
so
technology has really brought us all closer together. So it's like we all had to get like really good at Zoom and Google Meet and all of that during the pandemic. So I hated it at the time, but man, I'm so glad now that it forced me to get more comfortable with this type of platform. So 30 years ago, when I started into mental health, I would have never thought that technology would be a tool that would be utilized frequently in the mental health field. But there are so many ways it can be utilized to help make therapy more available and more productive. Dr. Wilcox, can you weigh in on this one?
Sure. So I also, my children, my teenage children attend Baltimore City Public Schools, and I first learned about Go Guardian Beacon actually from one of my colleagues who runs our emergency department at Johns Hopkins, and she called me, and this is Tish Ryan, Dr. Tish Ryan, and she called me and said, I actually just treated 3 Baltimore City students in the past couple weeks who were identified by Go Guardian Beacon and brought in because they were in crisis. One had made an active attempt and ingested quite a few pills. And so I first learned about it back then. I think I had heard about it from my own 2 children who attend school in the district. And then I started becoming really interested in what it's all about and learning about its potential, especially because our healthcare system sees the students on the back end. So the students that are identified and are in crisis and need to be brought to emergency care. And so that's one example of technology and how technology can help support schools. But I'm also involved in another project with the Youth Line, which is on the West Coast in Oregon, and planning a project with a program called Safe Social Spaces. And this is where folks will look on social media to identify students and young people who are typing disconcerting information on various social media platforms. And this service, Safe Social Spaces, the folks who work there, crisis counselors, can reach out to those young people and try to intervene with them and get them the care and support they need. So it's a more proactive approach. And if social media platforms are not willing to set something up to have this done, the various crisis systems that are out there can play a role. And so I think that is another kind of exciting use of technology. They're doing it manually now, but I'm thinking maybe AI, artificial intelligence, or natural language processing, or some kind of an automated approach could help on this front in the future of identifying posts on social media that are problematic and engaging that young person who's in crisis and care.
Yeah, it's so exciting to look at the possibilities that technology holds for us as mental health providers. I know when Beacon was first brought to my attention, I was not excited in the least bit. I didn't really see the value in it, but we began using it, and like Rebecca and Dr. Wilcox have both pointed out, like we were able to identify kids who were in crisis, and I was like, wow, maybe this really is a good thing. And we used it over the course of 3 school years, and which is why I ended up here. I believe so strongly in Beacon. I think the strength in Beacon lies in identifying those concerns upstream. And I wasn't expecting it to do that in the beginning, but after using it and seeing that it was identifying kids when they were first starting to struggle, like maybe Google searching, how do you know if you're depressed? Or, what do you do if you're getting bullied? And we were able to intervene before the behaviors started to change. Like the intervention models we used before depended on other people to recognize changes in behaviors. So we had already moved down the road in like mental concerns, psychological concerns. But Beacon Beacon caught him so fast that the interventions were easier and just required, like a crisis can take all day long. But a referral to a therapist can take 20 or 30 minutes. So it really helped the counselors in my district work smarter, not harder. So my initial perception of it was way wrong. So I'm glad to admit that I was wrong on that. Okay, so our next question that we want to cover is we know that mental health and violence prevention are often interconnected. What are some ways that schools can address this? And let's start with, I don't even remember who I did last. So let's start with Dr. Wilcox.
Yeah, they are really strongly connected. I think having solid training of folks on what to look out for when they identify students who look like they could be a victim of violence or dating violence, violence in the home, and so forth, and what training in the school to look out for, what to look out for in terms of risk factors. But also having more other kind of nested projects. And once again, I go back to education and anything we can do in health education class to prepare students for either experiencing this themselves or having a best friend who is having troubles in their home and is maybe the victim of violence, and what to do, like knowing when a situation is a life or death situation, and knowing when they have to get an adult involved, that they cannot handle it on their own, and even if their friend tries to swear them to secrecy, that they have to take action. And so I think those are really important things. But I also think, like we said, we've been talking about Go Guardian Beacon, and I think that plays a major role as well, complementary role to the other aspects that I just mentioned, the training and the direct interventions to students with health education class or another venue, I think is a nice combination.
And Becky, I know you were integral in getting a platform in place or a process in place to really assess threats. So can you talk about like why you wanted to involve mental health in that and how that unfolded?
Well, I think exactly like what Dr. Wilcox is, the training of staff is really critical and important. And when we started talking about violence prevention and having a threat assessment team, so when I was assistant superintendent, a lot of the discipline referrals that would get sent to me were extreme. Principals could give out of school suspension for up to 10 days. And then it came to my office if there needed to be further discipline. And a lot of those were threats of violence or acts of violence themselves. And sitting in those conferences with parents and the student, a lot of the things that came up, you could see the mental health struggle, and that the student was really struggling with mental health crisis. And oftentimes the parents or the caregivers were also having some mental health issues themselves. So when we really started looking at creating a threat assessment team to help us identify the threats of violence, I felt like a critical factor in that was having mental health involved, not only for identification and helping us identify threats, but also what do we do in response to those threats? We looked at and used the Virginia model for a threat assessment, and worked on that, I guess, off that platform, and created kind of our own in a previous district I was in. But the mental health piece was really important in that. Also in our crisis planning, that's something we really didn't talk about, but when you talked about our crisis planning, having a mental health professional involved in that crisis planning so that you're not, your response to a crisis doesn't create more trauma.
And Kelly, as the person who receives those referrals at the end, can you speak to that?
Yes, so we've started first we built a group thought we drugs, alcohol, and always the we
Kelly, you're breaking up if you can hear me.
okay,
Um,
hear me now?
yes.
Okay. So we do the groups and we try to address anger and violence and we try to address those things just in an educational way. And I notice a lot of times things come out. We also can recommend and we get the kids in for psychological testing, um, because trying to make sometimes school officials and SROs recognize that depression isn't just laying in your bed. Depression can also manifest as anger and violence, and that there's an underlying reason for that. So, our main goal is to try to get the testing done and try to form the relationship as quickly as we can so we can get to the bottom of the behaviors, and introducing the educational component. And it's kind of when we put them in the group, I kind of try to introduce it in a way that they don't realize that they're the ones being talked to. And then it kind of opens up some dialogue, um, and some more trust. But I think more it's just the education of letting everyone know that, you know, let's don't, we look at depression one way, but we look at anger and violence a different way. And maybe we need to, you know, remember that there is mental health issues going on. People don't just wake up one day and say, I'm going to be violent today. So,
Yeah. Yeah. So just addressing those underlying conditions
yeah,
that eventually can lead to possible violence.
yeah,
Um, like the research that I have found talks about how almost all people who commit acts of mass violence demonstrate mental health concerns, but not all people who have mental health concerns are going to be violent. Similar to all elephants are gray, but not all gray things are elephants. So I feel like in supporting mental health, we are doing primary prevention for potential violence later. Like Dr. Wilcox was talking about, a multifaceted, multi-pronged approach. Any one thing in and of itself isn't really going to have much of an effect, but coming at it from different directions, like in health classes and what we call in schools tier one instructions. So tier one instruction, tier two groups, and tier three individualized response. So it's a lot like the same systems that are used to support academics, and schools are very familiar with those systems, but I think a lot of people don't recognize that the same systems can work for mental health support and violence prevention. Okay, so I'm just going to kind of open this up to you guys and we'll go around one at a time. But for schools that are currently building mental health support systems, what is one solid piece of advice that you would like to share with them? And let's start with Rebecca.
I think surrounding yourself with the experts. As a school administrator and teacher, we think how like maybe like one class on mental health and supporting students with mental health. So getting the experts at the table and as part of the collaborative team to help you create the systems is really critical. I mentioned earlier, like the crisis team planning, having somebody that has a background in mental health, and that is critical. A previous district I was in had several crisis events happen. And honestly, if it weren't for Tracy being there, right there with us through all of that, I don't know that we would have handled it as well as we did. So I think having the experts sit at the table and bringing everybody together to give input on the systems that you're creating to support mental health.
Let's move to you next, Dr. Wilcox.
Sure. Just like Rebecca was saying, there's no need to reinvent the wheel. I mean, there's lots of good resources out there and materials, and so I think that's really critical. Is just trying to identify what types of services and approaches would meet the needs of your specific community. And I'm saying that I'm sitting right now in Baltimore City in my office at Johns Hopkins, where right now, in this calendar year, we have lost probably close to 10 students to firearm violence. So that is the context under which, these students in Baltimore City, including my own two children, are going to school with, in a context of a lot of violent incidences going on in the community. And so thinking about ways to address the specific needs or challenges and strengths within a specific community, and tying people in. I think we're really used to working in silos because sometimes it's easier to do that. But, thinking about engaging local representatives from the American Academy of Pediatrics. Each state has a bunch, representatives from the AAP, which is, pediatricians, and connecting with hospitals and even local academic partners who know about prevention science and engaging them in the work we're doing too. And it's more difficult and it may take longer to engage all those folks, but it could potentially help with the sustainability and the impact that you're able to achieve. And so partnerships are, I think, very essential to making impact.
Yeah, and I would like to underscore unique needs. Where Dr. Wilcox is sitting in an urban area. I think Kelly and Becky and I are in a very rural area, and your resources are different and your needs are different. But I believe every community has the resources you need to be successful. It's just uncovering those resources and identifying. So, unique needs, and Kelly mentioned that earlier. Every school district has its own unique personality. So just because a district is urban doesn't mean they are going to have the same needs as Baltimore. And just because a district is rural doesn't mean it's going to have the same needs as Gravette. So just really identifying your own unique characteristics and where your needs are and what your resources are. So Kelly, I'm going to let you wrap this one up.
So I guess when you're coming in as the mental health professional, I've noticed that explaining HIPAA, how we bring the kid to the session, what can come out of the session, and helping the school districts understand that we need a private place and they need an opportunity to, have their privacy protected. I've noticed that that's kind of been a big one because some school districts have it planned out when we get there. Some school districts are just randomly looking for a room when you show up, which makes it difficult. Mm-hmm. So I think that, the school districts need to think about how this is going to look, get allotting a room or an area for when that therapist comes in, that they will have somewhere to privately meet with the student and, then go from there. So I think it needs to be a well thought out plan and not just kind of throwing water at a huge fire. Because I think sometimes people think, well, we have a therapist in there and it's resolved. And I'm like, I have more referrals than I can handle. So we need to really look at it and figure out how to make this work for everybody.
And I loved how you described earlier that you are working with the school staff to help build their capacity. Mm-hmm. You're helping them learn to run groups on their own. So having you come into schools is not just helping provide services to students. You're helping the staff increase their capacity, which the impact of that is just huge. So,
yeah, we look at referrals. I'll sit down with the school counselors and look at referrals. Like one district, we had like 6 girls who were pregnant. And so, we started an educational group. So we just start kind of looking at subgroups as to what we can do.
Yeah, and that speaks to Dr. Wilcox's discussion about siloed approaches. I feel like in schools, that's that's a significant concern because people look at it from their own unique perspective, and you are going in and helping build, like break down those silos. I know Becky and I worked together in a former district, and we really tried hard to break down those silos. We actually built, well, a little background. We were in a district and our suicide rates were about 30 times the national average, and nobody knew what to do about it. And so they just didn't talk about it. They just pretended it didn't exist. And we are not one to shy away from problems. So she and I decided this needs to be addressed and it needs to be addressed head on. And we built the beginnings of a suicide prevention plan. And we pulled together members of the community. And in that community, we had a pediatrician, we had a family practice doctor, we had nurses. I actually think we had the mayor. We had we had people from children's division. One of the most powerful members of that community was the father of a student who had completed suicide. And he helped keep us focused and helped make it real. And when people would start to get into their like political issues, he would bring us back to this is the problem and this is why we're here. And I feel like overall, in my 30 years in the mental health field, I have seen the stigma start to break down and people start to be more willing to talk about it, but it's still very much there. And we need to continue to work to be more open and more honest about mental health. And mental health is just as important as physical health. It's all interconnected. And we can't do one thing or create a plan on paper and expect the problem to go away. It requires teams of very dedicated individuals to work together and come at it from all directions. I just read an article this morning and they used the analogy of a firefighter. You can't spray water on it from one direction, like you said earlier, Kelly. You have to surround it and drown the fire. And I really liked that analogy from that article. We do have like 3 or 4 minutes. Is there anything else that you guys would like to share with schools or with anyone who may be working in a system trying to build a mental health system right now? Just jump in.
I think it's important to the extent that we can to try to engage students and families in some of the work we do, because I feel like they often feel like they're left out. But having a youth voice and a family voice and having that support and buy-in and from youth and families is really important. And so, having youth involved in issues of workflow, with different approaches that are being done, family voice, I think is really important. It's hard, like I said, it's harder to do, but I think it's the future. There's legislation in Maryland that's focused on youth co-design of mental health services, and it didn't pass, I don't think, this time. But it's something that everyone's thinking about. Like, these people are the youth are the end users of our services. So why don't we have them involved in what those services would look like to make sure they're maximally engaging and appropriate and so forth. So that includes the youth and family voice. And so I think that would be one point that we didn't make earlier that I would like to make.
Yeah, and that is a huge point. Thank you for bringing that up. It's so important, but I think it's also very hard. When we first started our like really strong suicide prevention efforts at my previous district, I went into the health classes and talked to the health classes about what we were doing to support mental health and for suicide prevention. And for about the first year, every time I went in, they were angry. They didn't feel like they had a voice. They didn't feel like they were being heard. They didn't feel like they had been listened to in the past. So um, those classes were rough. Like they let me have it. Why are you asking? You're not going to listen anyway. So I think it's really important that when we do ask youth for their voice, that we listen and that we integrate their voice into our systems. As the years went on, the health teacher and I, the last year that I was in the district and we did this, um, I always ended with, okay, what do you think of this? And what are we doing right? And what are we doing wrong? And I just got, I was ready for them to hit me with, with all of this. And the last year, there was nothing. They were like, their feedback was, it looks like you're genuinely doing everything you can. And so just that change over just 3 years. But I would like to encourage people when you are starting this, just be prepared because the youth, at least the youth I was talking with, were angry because they didn't feel their voices were being heard. Mm-hmm. So be prepared to accept that anger and just hear it and be there with them and move through it and implement their suggestions. Listen. Do not ask families and students for their input if you're not going to listen and integrate it, because that only damages the relationships further. And sometimes it's hard to hear. Sometimes it's really hard to hear that you're messing up. Mm-hmm. So just develop some thicker skin and be willing to genuinely make changes based on their input. So you guys have been a wonderful, wonderful panel. I could sit and talk with you all day long. Thank you for joining us. And we at GoGuardian genuinely want to partner with schools to address the mental health crisis. So we want to be more than a vendor. We want to be a partner. So we have a host of resources on our website. I believe there will be a slide that'll pop up here in a moment with those resources. Thank you for joining us, and thank you for taking the time out to support mental health in your schools. Have a wonderful day.